Hello everyone! Before we begin our presentation, let us introduce ourselves, starting with me. My name is Melinda Nurholiza, and my friend.
Hello, my name is Carissa Primasanti, and we are currently in the 5th semester of undergraduate midwifery program.
On this occasion, we will present the result of our discussion regarding postpartum preeclampsia. The first one in introduction. Preeclampsia is defined as presence of blood pressure greater 114/19 mm of mercury along with proteinuria after 20 weeks of pregnancy on 2 or more occasions 4 hours apart. It is the most common form of hypertensive disorder in pregnancy. Although it is commonly reported during the time of pregnancy, sometimes it can be reported latest 4 to 6 weeks after the delivery, where it is defined as postpartum preeclampsia. However, it commonly occurs within the first 7 days after delivery of the baby due to absorption of extracellular fluid into the vessels. Presently, there are few studies on postpartum preeclampsia. A study in US showed the incidence of postpartum preeclampsia to be 5.7%. The diagnosis of postpartum preeclampsia can be missed due to our focus mainly of antenatal and intrapartum care. Here, we present a case of mother who developed postpartum preeclampsia in Yogyakarta. Next, the case report. A 31-year-old female, P1AB0, on postpartum day 5. She was admitted in the hospital on date 28 April 2021. Her antenatal period was unremarkable. She delivered a healthy male baby at 37 plus 5 weeks of pregnancy. She presented with complaints of bilateral leg swelling and examination. She had weakness of bilateral legs with power of 4/5. She was found to have high blood pressure of 118/120 with pedal edema positive. She did not having system of severe headache, shortness of breath, or visual disturbances. Her hemoglobin was 10 gram per deciliter with normal renal and liver function tests. Her blood platelets were also within the normal limits. The urine analysis showed urine albumin of 2+. She was started on tablet losartan 15 mg twice a day, tablet furosemide 14 mg once a day, and tablet nifedipine 20 mg once a day. She was treated a case of postpartum preeclampsia. Her blood pressure decreased on day 4 of admission and her urine albumin also became negative. Her symptoms subsided and she was subsequently discharged.
And I'm Carissa Primasanti, will continue the presentation. So, now we are in the discussion part. The most common cause of postpartum preeclampsia is presence of gestational hypertension or preeclampsia during pregnancy. Other causes include volume overload with intravenous fluids at the time of delivery, non-steroidal anti-inflammatory drugs for pain leading to water retention, and use of uterine atony drugs like ergotamine. Therefore, injudicious use of these drugs should be prevented. Preeclampsia can occur in the postpartum period, with 1/3 of them developing eclampsia, especially 48 hours after the delivery. Untreated postpartum preeclampsia can lead to eclampsia, intracranial hemorrhage, and reversible cerebral vasoconstriction syndrome. The management of postpartum preeclampsia includes avoidance of non-steroidal anti-inflammatory drugs and use of selected antihypertensives like calcium channel blockers and furosemide. The conclusion: the postpartum preeclampsia is usually uncommon. Due to this, there are high chances of missing out the diagnosis during the postnatal period. This requires close monitoring of mothers, especially among high risk like previous history of preeclampsia, maternal disease like kidney disease, autoimmune diseases, diabetes, high body mass index, and advanced maternal age. This is the references that we use. We have 8 different references from journals, books, and websites. So, that is the end of our presentation. Thank you, and we hope you can learn something from our case report. Have a great day.